Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related memory based question. Let's start. The first question. The condition where a patient sees a rope and fears it to be a snake is called dash. Option A, depersonalization. Option B, hallucination. Option C, illusion. Option D, delusion. The correct option is option C, illusion. Which factor decreases drug absorption from the gastrointestinal tract? Option A, increased blood flow. Option B, increased surface area. Option C, high lipid solubility. Option D, ionized drug form. The correct option is option D, ionized drug form. Which fiber type most effectively lowers serum LDL cholesterol by binding bile acids? Option A, cellulose. Option B, lignin. Option C, soluble viscous fiber. Option D, resistant starch. The correct option is option C, soluble viscous fiber. The area of inquiry in the grounded theory approach is option A, social structural process within social setting. Option B, behavior observed over time in natural context. Option C, holistic view of culture. Option D, lived in experiences. The correct option is option A, social structural process within social setting. The condition in which false beliefs are firmly maintained even though they are not shared by others is called option A, delusion. Option B, illusion. Option C, hallucination. Option D, delirium. The correct option is option A, delusion. Which of the following experiences does not easily reach awareness? Option A, preconscious. Option B, semi-conscious. Option C, conscious. Option D, unconscious. The correct option is option D, unconscious. Which pharmacokinetic parameter is primarily responsible for determining the time required to reach steady state concentration? Option A, clearance. Option B, volume of distribution. Option C, half-life. Option D, bioavailability. The correct option is option C, half-life. A clinical feature of a patient with major depression includes option A, psychomotor agitation. Option B, insomnia. Option C, feeling of outlessness. Option D, increased libido. The correct option is option A, psychomotor agitation. B, insomnia. Option C, feeling of outlessness. The primary reason of using medium chain triglycerides MCT in malabsorption patients is option A, they increase insulin release. Option B, they bypass lymphatic absorption. Option C, they are stored easily in adipose tissue. Option D, they provide essential fatty acids. The correct option is option B, they bypass lymphatic absorption. A 26-year-old woman presents with scanty menstruation, infertility, obesity, and hirsutism. Which endocrine abnormality is most likely associated with her condition? Option A, decreased androgen production. Option B, hyperprolactinemia due to pituitary necrosis. Option C, insulin resistance with hyperandrogenism. Option D, hypothyroidism with low LH level. The correct option is option C, insulin resistance with hyperandrogenism. Which drug calculation formula is correct? Option A, dose required is equal to available dose per desired dose into volume. Option B, dose required is equal to desired dose per available dose into volume. Option C, dose required is equal to desired dose into available dose. Option D, dose required is equal to volume per desired dose. The correct option is option B. Dose required is equal to desired dose per available dose into volume. Patient on rifampicin reports orange red urine. Nurse should option A. Stop drug immediately. Option B. Inform patient it is a harmless expected effect. Option C. Start IV fluids to flush drug. Option D. Test urine for blood. The correct option is option B. Inform patient it is a harmless expected effect. Memory traces are present in the mind in the form of option A. Diagrams, option B. Engrams, option C. Pictures, option D. Signals. The correct option is option B. Engrams. What are the formal processes for testing a hypothesis? Option A. State, formulate, analyze and interpret. Option B. State, analyze, formulate and interpret it. Option C. State, formulate, interpret and analyze. Option D. Formulate, state, analyze and interpret. The correct option is option A. State, formulate, analyze and interpret. Which hormone is primarily responsible for uterine contraction during labor? Option A. Estrogen. Option B. Progesterone. Option C. Oxytocin. Option D. Relaxin. The correct option is option C. Oxytocin. Which drug calculation method is most accurate for pediatric dosing in critical care setting? Option A. Young's formula. Option B. Clark's formula. Option C. Body surface area method. Option D. Age-based dosing. The correct option is option C. Body surface area method. Which receptor type is associated with ion channel regulation? Option A. G protein coupled receptor. Option B. Tyrosine kinase receptor. Option C. Ligand gated ion channel. Option D. Nuclear receptor. The correct option is option C. Ligand gated ion channel. Patient on MAO inhibitor must avoid food rich in tyramine because a tyramine causes hypoglycemia with MAOIs. Option B. Tyramine increases serotonin leading to serotonin syndrome. Option C. Tyramine triggers hypertensive crisis due to norepinephrine release. Option D. Tyramine inhibits breakdown of dopamine. The correct option is option C. Tyramine triggers hypertensive crisis due to norepinephrine release. The most common cause of postpartum hemorrhage is option A. Retained placenta. Option B. Uterine atony. Option C. Genital tract trauma. Option D. Coagulation disorders. The correct option is option B. Uterine atony. The most effective nutritional intervention to reduce neural tube defects is option A. High protein diet. Option B. Folic acid supplementation. Option C. Vitamin D supplementation. Option D. Iron rich diet. The correct option is option B. Folic acid supplementation. Which of the following is a common myth about schizophrenia? Option A. It is a brain disorder. Option B. People with schizophrenia are violent. Option C. Treatment can help manage symptoms. Option D. It affects daily life. The correct option is option B. People with schizophrenia are violent. In psychiatric nursing, which defense mechanism is seen when a student blames the teacher for poor exam results? Option A. Projection. Option B. Regression. Option C. Sublimation. Option D. Rationalization. The correct option is option A. Projection. With PPE is essential for preventing airborne transmission. Option A. Surgical mask. Option B. Gloves. Option C. N95 respirator. Option D. Gown. The correct option is option C. N95 respirator. A child presents with prolonged fever, conjunctivitis, strawberry tongue, and coronary artery aneurysm. What is the diagnosis? Option A, scarlet fever. Option B, rheumatic fever. Option C, Kawasaki disease. Option D, toxic shock syndrome. The correct option is option C, Kawasaki disease. Which immunoglobulin is primarily involved in mucosal immunity in children? Option A, IgG. Option B, IgM. Option C, IgA. Option D, IgE. The correct option is option C, IgA. Which sterilization indicator confirms effectiveness of autoclaving? Option A, chemical indicator. Option B, physical indicator. Option C, biological indicator. Option D, mechanical indicator. The correct option is option C, biological indicator. Which condition leads to maple syrup odor urine? Option A, PKU. Option B, MSUD. Option C, tyrosine. Option D, homocystinuria. The correct option is option B, MSUD. Which type of immunity is transferred from mother to fetus via placenta? Option A, active natural immunity. Option B, passive natural immunity. Option C, active artificial immunity. Option D, passive artificial immunity. The correct option is option B, passive natural immunity. A child presents with tetany. Which electrolyte imbalance is responsible? Option A, hyperkalemia. Option B, hypocalcemia. Option C, hypernatremia. Option D, hypomagnesemia. The correct option is option B, hypocalcemia. What is the other term for recovery from an illness? Option A, rationalization. Option B, reaction formation. Option C, regression. Option D, remission. The correct option is option D, remission. A pattern neonate develops respiratory distress symptom RDS. Which cellular deficiency is primarily responsible? Option A, type 1 pneumocytes. Option B, type 2 pneumocytes. Option C, alveolar macrophages. Option D, Clara cells. The correct option is option B, type 2 pneumocytes. Which component of the chain of infection refers to the place where microorganisms normally live and multiply? Option A, host. Option B, reservoir. Option C, vector. Option D, portal of entry. The correct option is option B, reservoir. Which indicator reflects fertility level in a population most accurately? Option A, crude birth rate. Option B, general fertility rate. Option C, total fertility rate. Option D, net production rate. The correct option is option C, total fertility rate. Which component of communication ensures feedback in a communication process? Option A, sender. Option B, message. Option C, receiver. Option D, channel. The correct option is option C, receiver. Which epidemiological measure is most appropriate for assessing risk? Option A, incidence rate. Option B, prevalence rate. Option C, case fatality rate. Option D, attack rate. The correct option is option A, incidence rate. Which of the following base defines total fertility rate? TFR. Option A, the average number of children born to a woman during her reproductive years. Option B, the percentage of women who are pregnant. Option C, the average age at which women have their first child. Option D, the number of live births per 1,000 people in a population. The correct option is option A, the average number of children born to a woman during her reproductive years. The respiratory center is located in option A, cerebrum. Option B, cerebellum. Option C, medulla and pons. Option D, hypothalamus. The correct option is option C, medulla and pons. The vaccine that leaves a permanent scar in babies is option A, measles, option B, pentavalent, option C, DPT, option D, BCG. The correct option is option D, BCG. The example for distributive shock among the following shock type is option A, anaphylactic shock, option B, burn shock, option C, surgical shock, option D, hemorrhagic shock. The correct option is option A, anaphylactic shock. The drug of choice for treatment of OCD is option A, diazepam, option B, fluoxetine, option C, carbamazepine, option D, lithium. The correct option is option B, fluoxetine. Negative symptom of schizophrenia includes option A, auditory hallucination, option B, paranoid delusions, option C, flat affect and evolution, option D, disorganized speech. The correct option is option C, flat affect and evolution. Thank you for watching. Please like and subscribe.